Informed consent means that the consent of a patient for any procedure or treatment can only be taken after fully inform him about the nature of his condition. Silent features. Consent always should always be informed. Example of uninformed consent. Patient comes to doctor with chest pain. Doctor advises bypass. Patient is afraid of surgery, but consents since necessary to save life. Bypass done. Patient learns from someone that stenting was also an option. May sue doctor for damage alleging that the option for of stenting was never told to him. This is consent given under a misconception of fact, thus no consent section 90 IPC. Example of uninformed consent, the same case above. The doctor informs all the available option to him, cost of all treatment, outcomes, prognosis, and lets the patient decide which treatment he chooses. Components of an informed consent. Informed consent has five essential components, that is disclosure, comprehension, actual consent, absence of any outside control, competence. That is this already mentioned. If there is the nature and option and the prognosis, everything. Transmission of the informed consent. First is disclosure. Disclosure. Transmission of information is material to a decision. Comprehension. Comprehension is substantial understanding the information. Absence of any outside control over the decision. Competence and disclosure component 1. Patient must be told the disclosure component. Patient must be told the nature of his disease, options available, or treatment options, cost, risk, benefit, success and failure rate, after effect and prognosis of each. In case of surgery, whether it should be under local anesthesia or general anesthesia, possible harmful effect of the anesthesia, details of all possible operative procedure, their relatives benefit and risk, cost of each, risk of not receiving any treatment, informed refusal. Comprehension component 2, that is language. Explanation must be done in patient's own language. If need, a interpreter may be employed. A communication problem. If patient has a communication problem, deaf, dumb, blind, a doctor should make sure he has understood everything that a normal communication power would have understood. Absence of any outside control over the decisions. Component 3, any outside control over the decision. Doctor, nurse, paramedical staff, or any relative not influences the decision. If patient voluntarily asks for advice, it may be given. Competence 4. The patient should be above age of the consent more than 12 years for general physical examination, more than 18 for the surgery, should be mentally sound, should not be under the influence of drug or alcohol. Actual consent component 5. Written and witnessed. If to make it legally acceptable, everything explained must be reduced to writing, and signature of the patients must be obtained. Presence of 2 independent witnesses to prevent any allegation that the consent was forged or obtained under compulsion or pressure. Okay. Next is advantages of taking informed consent for reasons for obtaining consent. Patient cannot sue under section 350 IPC, under section 351 IPC for obtaining consent by misinterpretation of fact. Section 90 IPC, legal aid to examine, treat or operate upon a patient without consent, even if done in good faith, is punishable under above section. The principles which forms the basis of an informed consent principles, that is principle of disclosure of principle of full disclosure, or patient's right to truth, of patient's autonomy. Principle of full disclosure. The principle of full disclosure states that that a doctor should reveal all information. A doctor should reveal all information to the patient regarding his disease, treatment, and treatment options, and withholding information from a competent patient from a competent is a violation. Withholding information from a competent person is a violation of doctor's role as a fiduciary and is not justified. Exception to principle of disclosure: doctor need not disclose the risk of which he is himself does need not disclose of which he is himself unaware. The risk is so obvious that a person with normal intelligence can be easily understand therapeutic privilege. Okay. Next is exception to informed consent. Section 92 IPC, a person is found unconscious on a road and brought by someone passes by to hospital. Doctor determines in good faith that a leg must be amputated to save life and can do so without consent. The patient cannot be aroused from his unconsciousness. However, if patient arouses from unconsciousness, he is fully responsible and refuses for amputation. It cannot be carried out, and such amputation against consent is an example of parentalism. The exactly some provisions apply for mentally unsound, the intoxicated persons under 12 years of age, person otherwise of incapable of giving consent. Example: patient consent to laparotomy. During operation, doctor discovers an anticipated condition which endangers the life of the patient. Patient is under anesthesia. Consent for the new operation cannot be taken. Doctor undertakes a procedure and protected under section 92 IPC. This exception, however, does not extend to causing death. Doctor finds a lesion which cause excruciating pain to a patient, and he is sure the patient cannot live for more than 6 months. The lesion, he decided to commit euthanasia to save unnecessary suffering. It is illegal. And a therapeutic privilege, waiving of rights by patient. Patient expressly waives his right to informed consent to a doctor. Thank you.